I have a number of studies I'm conducting at the City of Hope with molecules we either developed or novel conceptual approaches. One example is a novel nucleoside analog. It targets RNA rather than DNA, and we have a trial in acute myelogenous leukemia that's sponsored by the Rising Tide Foundation out of Switzerland with an NIH grant for correlative studies. And it's a dose escalation study, and we've seen activity mirroring what we see in the test tube and in animal models. And it works against all forms of acute myelogenous leukemia as well as acute lymphoblastic leukemia, regardless of the mutation status. We've also repurposed an arthritis drug called leflunomide. We conducted a trial in myeloma, and we've seen significant clinical benefit in a number of patients. This is a drug that's been given to hundreds of thousands of individuals with autoimmune diseases, in particular rheumatoid arthritis. So it's oral, it's inexpensive, well tolerated, and it has efficacy in myeloma. And the third approach, which is now just in its infancy, I think the first patient went on study this week, is conceptually involved in blocking sugar uptake in cancer cells and then affecting its potential metabolism. And so we're taking advantage of an off-target effect of an HIV drug called Ritonavir, which interferes with a protein called a GLUT protein on the surface of a cancer cell that takes up sugar. And by blocking that, you block the uptake of sugar in the cancer cell, and then we find that the cancer cell responds, but we can block that altered metabolism with a drug called metformin. And the combination in the test tube and in animals is very effective. And so we're now conducting a trial in myeloma and in chronic lymphocytic leukemia with the combination of these drugs.